Okay. So hi everybody, I'm Sana and I'm the trial coordinator of the eADVICE program. So I'm just going to briefly talk about the current pilot that we're doing for eADVICE. So eADVICE stands for Electronic Advice and Diagnosis via the Internet following computerised evaluation. So currently the waiting time at the multidisciplinary clinic for urinary incontinence at the Children's Hospital at Westmead is 2 years. And in response to the waiting time, we've designed an interactive online decision aid tool for families with the support from their GP. The program design has followed evidence-based algorithms for managing urinary incontinence in children. We've developed, tested and revised the program over 4 pilot studies involving a total of 75 children so far. The previous pilots have demonstrated a poor adherence to treatment advice, so we've developed an animated virtual intelligent agent, which we're currently testing as Pilot 5. So eADVICE provides assessment, diagnosis, treatment advice, monitoring, feedback and education for the participants. The child's data is stored and used to monitor progress to provide feedback for subsequent visits. The family can go in every week for 6 months and they're supervised by their GP who can log in and see only their own patient's data. The program asks 15 questions framed for the parents or the child if they choose to use the child version of the questions. The questions are about age, weight, incontinence details, bowel habits and fluid intake, and there are possible 6 treatment options given. The medication is one option, but only after conservative treatment has failed and only with GP support and approval. We hope that by improving adherence, the treatment advice provided by the animated virtual agent who is able to express empathy and encouragement to the child. So the aim of our current pilot is to assess whether incorporating an animated virtual intelligent agent into the program will improve patient adherence to the treatment advice. And our current pilot is for 100 children. We hope to achieve our aim by asking the family to fill in a questionnaire at baseline and again at 6 months, looking at frequency and severity of wetting. At 6 months, they fill in a survey to assess parental acceptance and reporting of adherence to the individual treatment options given by the virtual agent. Then once the patient has completed the 6 months, we ask the referring doctor to fill out a survey to assess their attitude and acceptance of the program, and we're also going to examine frequency of visits to the program. So this is an example of a slide showing what the questions looks like, and this is a child version, so it's got simpler wording and it's got a friendly picture. This is an example of the slide for once the family have answered all the questions and they come up with their treatment page. So the family can actually click on the virtual agent here and she will talk through all the treatment options with them, and the family can opt to click on conversation, have a longer conversation by clicking on various questions, and the agent will have like a virtual conversation which we hope will be more supportive and answer the parents' questions, almost equivalent to face-to-face. So the baseline characteristics of the Pilot 5 program up to mid-September, the age group was from 5 to 16 years. There were 34 boys and 26 girls. 61% had monosymptomatic nocturnal enuresis, 36% had non-monosymptomatic nocturnal enuresis, and 3% had daytime urinary incontinence only. 98% with, oh, I did that by itself. How do I go back? Previous. So 98% wet more than 3 times a week, and 87% soaked their pants or pull-ups when they wet. And the results leading up to mid-September, there were 61 patients using the eADVICE program. 13 of the 61 had completed their 6 months treatment. Of the 13 that have completed, 3 were dry, and there are also another 4 who are dry but they haven't completed their 6 months yet. So this is a slide showing the patients who are currently using the program. Who are currently using the program, and those that have completed the program are in navy. And this slide is exactly the same, but it shows the arrows represent the number of visits used by the patients who became dry, and it's all 7 patients who've become dry I've grouped together, and they all use it an average of 2 to 4 times. So, in conclusion, Pilot 5 is an ongoing program. We hope that the improved interaction with the virtual intelligent agent will result in improved treatment outcomes. And if the program is successful, it could potentially reduce the clinic waiting times and improve community management of incontinence in children. So recruitment is nearly finished. We've nearly reached 100. So if you would like to refer someone, please email me. It's at that email address on the screen. And also, we'd just like to acknowledge the support of the Foundation for Children, the Australian Bladder Foundation, and all the families and GPs who've participated in the pilot study. Thank you.